I am Dr. Sridevi KN. I am a consultant surgical gastroenterologist working in Bangalore in Chirag Global Hospital. So a lot of times I am asked if there's any difference between colon cancer and rectal cancer and the way that they are treated. Essentially no, because when it comes to cancer, the aim is to get rid of the cancer entirely from the body. So how we do that with colon cancer and rectal cancer is again dependent on the biopsy, but to give you a very broad idea, colon cancer responds very well to surgery and chemotherapy, and rectal cancer responds very well to a combination of all three: surgery, chemotherapy and radiotherapy. So if I have to point out one difference and say, then probably that rectal cancer is more responsive to radiotherapy as compared to colon cancer. So that may be one added form of treatment that you will undergo if you have rectal cancer. So if you have undergone a colorectal cancer surgery, then see, honestly this depends on what stage and what sort of procedure you have undergone. So there are two main differences. One is if you have undergone a complete curative surgery, or if you have undergone a palliative surgery or a sort of temporary or limited sort of surgery. Okay. So if you have undergone a major cancer resection, then depends on which part of the body you have been operated on, whether it is your colon or your rectum, and whether any additional procedures such as a colostomy or an ileostomy have been done. So in a standard setting, if you have undergone an open surgery where they have opened your abdomen and done the surgery, then you may need anywhere between 1 to 2 weeks to recover from the surgical procedure. If you have undergone a laparoscopic procedure or a robotic procedure, you may require anywhere between 1 to 7 days to recover. So definitely when we use minimally invasive procedures such as laparoscopy or robotic, then your recovery time and your wound healing time is a lot faster. Certainly, there are side effects for chemotherapy and radiotherapy regardless of what cancer we use that treatment for. So, chemotherapy and radiotherapy target the cancer cells, but there are normal cells of the body as well, especially with chemotherapy, which is given in a systemic way, meaning that we give it directly into your blood vessels. So it can reach the system. So there are certain parts of your body which are very susceptible to side effects, such as fast growing organs, like it could be your skin, your hair, your nails, and the inner lining of your intestine, your stomach and your intestine. So these are the most common side effects we expect with chemotherapy. You can have a lot of hair loss, you can have very dry skin or irritated skin. Similarly, you can have a very irritated intestinal lining, you can have a lot of loose stools, you can have vomiting. So these are some of the extremely common side effects that we can expect with chemotherapy. Similarly, with radiotherapy, thanks to advanced radiotherapy and very limited or very precise radiotherapy, the side effects of radiotherapy can be reduced, but yes, there are definite side effects for chemotherapy and radiotherapy. Can colorectal cancer come back after treatment? So it depends on at what stage you were diagnosed at the first time. So if you are somebody who has undergone treatment for colorectal cancer, it depends on what stage you were first diagnosed with, what sort of treatment you were asked to undergo and what sort of treatment you did undergo, and any follow-up treatment which was advised. For example, if you have somebody who had a very first stage cancer and you were advised to undergo surgery followed by chemotherapy and you have completed your entire treatment, then the risk of recurrence will be very low. But if you are somebody who had been diagnosed at the stage 4 where it has already spread to other parts of your body such as your lungs or your liver, and whether you have received any treatment or no, then yes, the risk of recurrence is much higher as the stage advances. Okay, if you have colorectal cancer in the early stage, again, it depends on what type of cancer do you have, and when we say early stage, it is an extremely vague term. So we look at the lining and how far the lining has been breached. So if it has, and if there is a local spread of cancer, then yes, you will need chemotherapy. In some cases, you may need chemotherapy before you undergo a surgery. In some cases, you may require chemotherapy after you undergo a surgery.